That was back in 2020. I was very close to do complete knee replacement. I happened to run into Dr. Nathan's commercial flyers talking about doing something different treatment. So I came here to give a try. At that time, my knee was really bad. Both knees, one had a very, most bone and bone. The other one is a moderate. So I gave it a try, and my husband came with me. So I feel relieved the first time, and we started the plan. I was waiting for the hospital to give me a call because during COVID in February, they called me. By that time, I was better off. I don't feel the pain. I walk fine, and I just have to come here to do the maintenance. So I've been doing that since 2021 to now. And I was very close to do the knee replacement, so I know my limit. So, but SoftWave really gave me the chance to be walking like a normal person. I don't have to, depending on the painkillers. I really like the software because it's kind of pinpoint to the area and give me the enough blood flow and support that. And I do a lot of exercise to support my muscle, and I lost some weight. So last year, unfortunately, I tripped and fell. So after I was slowly recovering, I noticed my back was like in pain. So I used my MRI report and I discussed it with Dr. Nathan about the treatment. And that's how he recommended on the decompression because some of the spines are very pressed. In general, I'm pain-free. I enjoy that. Without the pain, it's not really bothering you. When you have a back problem, it is not comfortable. And I, with this treatment, I think I feel better and I will do better.